So we are live. This is Time to Talk with Gillvray Health, and I am very excited today to be joined by Lucy, who's obviously my co-founder and partner in this whole journey.
Yeah.
COO as well, officially.
COO, yeah.
Of Gillvray Health. And we thought it would be really helpful to have a conversation between the two of us. We used to do this
All the time.
all the time. But there's been a lot that has changed, I guess, in the last few years, maybe. And we thought we'll have a little bit of a chat today about what we're doing and why we do what we do.
Yeah, why we do what we do.
Do you want to tell say a little bit about our journey and what we've been up to together?
Yes, well, I'll take it right back to the beginning, shall I? Just briefly. So we met on the school run, I guess, didn't we? And Claire, obviously a GP, and I am a yoga teacher. And we quickly found out that I was seeing lots of people that needed Claire. Claire was seeing lots of people that needed me. And so we felt there's a gap here that needs to be filled, whereby you can see someone, look at someone, help someone as a whole person rather than separating things out. So cognitive sports therapy was born, which we are no longer cognitive sports therapy, but that's a really special time actually, because it was that name really reflected what we did. We wrote a book, lockdown happened, and we found that actually that was quite a pivotal time for us, wasn't it?
Yeah.
Where people really were sort of needing the things that we were doing. And then sort of fast forward, how many years now? 5-6 years.
Yeah.
We're here in Cambridge in our clinic on Hills Road, Cambridge's first lifestyle medicine clinic. There are people in the building. It's full, it's noisy, it's lovely, it's full of life, and we are helping people in lots of different ways.
Yep, absolutely. I think that's the thing that was key to us kind of getting together, wasn't it? It was just that we felt like people were asking to be seen as whole people.
Yeah.
That they were struggling in that world of whether this is something that's medical and therefore maybe needs some medicine, but actually wanting to be empowered in terms of looking after their own health as well. And I think we felt like whenever we brought both our skill sets together, we were able to really help in that space.
Yeah, and I think that word empowerment is really important, because we are helping the individual, but I think that the nicest thing about what we do is that we're helping those individuals really take control and be empowered and be in charge, and feel confident in the decisions that they're making, and knowing that when they work with us, we're here as a team. We see everything, and we see you as a whole person, and it all comes back to the patient or the client, doesn't it? It's always they are at the center of everything that we do.
Yeah, absolutely.
And our goal is to help them feel empowered and in control and heard and seen.
Yeah, absolutely. So I think there's kind of a real thought around prevention in terms of health with us as well, isn't there? So we're really kind of doing more in the world of the kind of health assessment, fitness assessments now.
Yeah, which are amazing.
Which are really good. I think we're kind of trying to go that one step beyond it just being a checkup, and actually trying to listen to the individuals that we see. We're using things like CGM data. We're getting them on our treadmill here. We're talking to them about their nutrition, their stress, which is often really missed, and their sleep, and really trying to help them to kind of have a real individual take on their health, as opposed to sort of a tick box exercise in terms of an assessment. So that's really been really exciting to take that to the building.
And that's what I've loved so much about the last couple of years, is that we've taken what's already out there in different forms, and we've kind of put it all together and made it even better. So that when someone comes to see me they want to do some PT, for example, they don't just get a cookie cutter PT program. What they get is a fitness assessment that lasts, a good hour, where we test their VO2 max. We look at their mobility, their flexibility, their strength profile. We look at their body composition. We create a report that is individual and unique to them. And then from that data, and we ask them about their goals, and then from all of that we build a program for I mean, it's amazing,
Yeah.
isn't it?
It's really
And and they can work with me as PT, nutritional advisor, but knowing that I've got the backup of a full nutritionist upstairs, a doctor here, like it's so cool.
It's really great. And it's really nice to see people kind of getting it and coming and asking for it, because I think there's that need now, isn't there, to look after our health, to understand that there are things that we can do that aren't necessarily medication based, and there's an ask for it, and it's really nice to be able to provide what people are asking for.
No, it really is.
And we still do other exciting things, don't we? So yesterday we were at the Muller Centre here in Cambridge with Pure Resourcing Solutions, and being part of their Women in Leadership programme, talking to a great inspiring group of women about kind of embracing their health, taking charge of their health, becoming the CEO of their health.
Yeah, so these are women who are senior women in big organizations. So it's the Women in Leadership program. And these women have hugely demanding jobs. They often have hugely demanding lives outside of their jobs. And what we do is we go in and we help them to sort of take that same approach that they take to managing their businesses, to managing their health. And it's one of my favorite things that we do. It's the third time we've done it.
It's the third year, because it's not just a one-off. So they run a whole program, and we're there still in the background, and we'll go back and revisit those women. And yesterday was really lovely, because we had a sort of accountability moment where we all kind of talked about what we were going to do moving forward. So it's not just about what was happening yesterday. It's about, okay, what did I promise to myself a little bit?
Yeah.
I've said it out loud in front of this group, so therefore it's more likely to happen.
Yeah.
And making those intentions, not massive changes, all about that, like small steps done consistently over a period of time, making the most difference. And
it's about taking one thing, isn't it? You don't have to take everything on board, but take that one thing that resonates with you and move forward with that. And I love it when we go back in a couple of months' time and we get to hear all these lovely stories about what's changed for them and how they're feeling, and it's always so lovely, isn't it? There's usually so much positivity at that second session. Yeah,
really, really great. So we do also still look after some companies in their mental health and well-being. We have some therapists in our books that we use for those sorts of groups, I guess, within the kind of corporate world.
And what's lovely about that is because we're a smaller organization than your Bupas and your Avivas and things like that, but we really take care of our corporate clients, as we do with all our individuals. And it means that because we've got this wonderful team of therapists that we work with, someone can come through and see someone within 24 hours, which in lots of the other bigger sort of setups, it's a lot more kind of prolonged than that. So we feel really passionate about being able to help in the moment, as well as with the kind of the broader sense,
and being a little bit more thoughtful. So I will often say in those assessment appointments, like, feel free to put anything into this space, because often within a corporate mental health well-being service, you're maybe talking to a psychologist and you're very much needing to keep that conversation within the psychology world. Whereas we know, don't we, that life and physical health and other things actually impact on our mental well-being. So to be able to kind of say that there's been something that's been worrying you in terms of your physical health, or that there's medications that you're taking, or just able to open that door to anything that's worrying you, as opposed to feeling like I'm just allowed to talk about my mental health, I think is something that we get really good feedback about.
Yeah, I think that's something that we're really good at as well. It's sort of creating that sort of safe space where it's all open for discussion.
And another big area that we've been doing a lot of work in is the weight management space,
which has been just brilliant, hasn't it? We've taken something and just made such a positive impact for so many people, just in a really well managed, safe, sensible way, which is some of the feedback. I love the feedback that we get. It's health, isn't it? It's not anything other than this is your health, and we're improving all these markers, and people that previously weren't able to kind of go to the gym or work with a PT, they're now at that point where they're working with us, and just it's amazing.
Yeah, no, I think it's been a journey, hasn't it? And I think because I think for a long time we were never a group or people that kind of focused on scales or weight. And it's lovely to still keep that at the center of everything, because whenever we work with our patients, it's not really all about what's happening on a scale. It's a lot to do with how they're feeling, how their bodies are moving. And a lot of people will feel feedback that they feel more like themselves again.
Yeah.
And that's something that is not to do with, a company that's going to promise that you're going to lose a certain amount of weight in a certain amount of time. It's all about actually just, it is finding yourself again. It's getting your health back. People will tell me, they want to age with their grandchildren. They want to be able to run around with their own children. I've got young people as well who've come forward who just already know that they need to be making changes, and they just want to do it in a safe and supported environment. And it's been really lovely to bring that together, and actually to the tiers that we have around whenever we're talking about, okay, so this is not just about your nutrition, it's not just about what you're doing, but what's happening in your life, the stress that you're carrying, and that compassion I think that we give. We get really good feedback in terms of that, because we know there are some people out there doing absolutely everything they can do, and they are struggling with living with obesity and living with overweight, and it's really, really lovely to be able to come in and help them with that.
It is, and I think it comes back to that whole person view. It's not about just a number, is it? It's about uncovering what that individual profile is, and then helping that person with those things. And everyone is different, and again, I think that's the lovely thing here, is it's about that relationship between us and our patients, and everyone bringing their own unique skill set to that person to help them with what they need. It's really special.
It's great. So I guess in summary, we're set up here in terms of seeing individuals, one-on-ones. You have some clients that you work with as a
couple twos, so friends. So that's a lovely thing to do, actually, is to just, if you want to embark on a, fitness or training regime, but you don't want to do it on your own, bringing a friend along and doing it together and having a program written for you as a pair is so lovely.
And you can see me as a straight kind of private GP here, or you can see me in my lifestyle medicine kind of hat. We still do online work, so I have some patients who are further afield, and I do online clinics from here. Through our kind of weight management, we run some educational kind of sessions. So our nutritionist and our other doctor, who's Dr. Susanna, who we might get on here next week, runs educational sessions for our patients, which is really lovely. And then we've kind of got our kind of corporate and group work that we do on the side as well. And you're still doing your kind of online and face-to-face yoga sessions.
So I do a couple of group. I think one of the things that's coming out from this conversation for me is one of the 6 pillars of lifestyle medicine is community. What's the word? Connection. So everything that we've been talking about today, I think you can weave it into, we are building these communities. So, on my way to the clinic this morning, I have a WhatsApp group with all of the people that I train, all my clients that I train that are here as Gillvray Health. And there was just a message that came through, and it was just the most inspiring, lovely, really short little message. And then everyone's liking and hearting it. And it's like, this is our little community. And then within the weight management space, we do these educational talks, and there's a community there where everyone it's not just you sit and listen, it's participation. You can just sit and listen if you want to, but again, it's community. And that's what I love so much about what we do, because when we think of our health, being connected to ourselves, to the world around us, but also to other people, is the evidence is there, isn't it? To say how important that is for our health and our longevity. And that those 6 pillars, which maybe we should do another session on the 6
We can do
pillars, but
some-
that really sits at the heart. Those pillars sit at the heart of everything we do here. So you don't just ever come in and have one thing. It's always, we try and link it into everything, and you'll always find that there is a link, isn't there?
Yeah, no, it's really lovely, and I think we just love what we do.
We do love what we do.
But yeah, thanks for listening. Hopefully that was
Thank you.
helpful. And you can find out more information about us on our website, which is gillvrayhealth.co.uk.
Yeah.
Thanks.
Bye.
Bye-bye.